A herniated disc, or slipped disc, describes a common source of pain in the neck, lower back, arms, or legs. Between the bones of the spine sit soft, rubbery discs of tissue. These discs allow the back to flex and bend, and also act as shock absorbers. A disc herniates or ruptures when part of the center nucleus pushes through the outer edge of the disc and back towards the spinal canal. This puts pressure on the sensitive spinal cord, which can result in pain, numbness, or weakness that radiates into the limbs. Disc herniations usually result from injuries, but degenerative disc disease can make them more likely to occur. Symptoms of a herniated disc include back pain, weakness in one arm or leg, tingling or numbness in one arm or leg, or in serious cases, loss of bladder or bowel control. If patients show signs of a stable herniated disc, the physician will attempt to relieve the symptoms with conservative treatments, such as oral or localized steroids, recommended stretches, exercises, and decompression therapies. Surgical herniated disc treatments can vary depending on the severity and location of the disc, ranging from minimally invasive procedures such as a microdiscectomy, or more complex procedures that can involve disc replacements and fusions of vertebral bodies. Specialists can treat many herniated discs as outpatient procedures, meaning patients may leave the hospital the same day while wearing a brace to restrict movement. The surgeon will see patients again after some time for a follow-up appointment and sometimes prescribe physical therapy.